Hey everybody, something I want to talk about today is in regards to acupuncture. I feel like we don't get as much time to talk about acupuncture as often as I use it in my practice. And I think that there is definitely a lot of information out there. It's probably one of the most accessible integrative modalities, but there's still a lot of people that don't know about it and don't know what it's used for. I think that acupuncture in general gets a lot of support and advertisement for pain control, but there's a lot of other things that it can do as well. So I just want to share some of those with you so you can be thinking about it in different disease states. So acupuncture is the use of basically very small needles at specific points along the body. So this is a treatment modality that's been around for over 3,000 years, basically originating in China. It's been used in people for a very, very long time and almost as long in animals. So originally, the first animals that were treated with acupuncture were actually the emperor's horses in China because they would use it to enhance their performance and longevity and strength in battle. It wasn't used in animals in the United States until about the 70s. It took that long, really, for it to get all the way over to the Western world, but it's been pretty commonplace since then. And there actually is a fair amount of scientific evidence for different things of benefit in animals like neurologic conditions, disc disease, cruciate ruptures, pain control, even nausea associated with chemotherapy. So basically what we do is we take a very small needle. They usually are individually wrapped. Sometimes they're not, but they're always sterile, obviously. Very, very tiny, much smaller than the size of a needle that would be used to draw blood. And it's inserted into the soft tissues, just the skin and the soft tissues underneath, in places all over the body. How we determine where we place them over the body is based on what's called meridians, or basically channels. And these channels have been mapped over thousands of years and are believed to influence different parts. So from a Western perspective, when we look at where those acupuncture points are located on the body, we find that they're where a lot of nerve fibers are together in little bundles, or where they bifurcate or basically split off. Now, from a Chinese medicine perspective, when we stimulate these acupuncture points, what we're doing is we're basically allowing balance in the body. Basically, the free flow of what's called qi, or the energy in our body. That's a very unfamiliar verbiage. So from a Western perspective, what that means is that basically by us using these very small needles to stimulate these acupuncture points, we're causing nervous system stimulation. And in that nervous system stimulation, we are increasing blood flow, releasing pain, releasing endogenous anti-inflammatory compounds, endogenous opioid-like substances, and it can be very relaxing. I have a lot of clients that will say to me, oh, well, how will my dog stay still? How will my cat stay still? Won't they run away from you? But in reality, what happens is as those endogenous substances are released, it becomes very relaxing and a lot of animals fall asleep. So we know that pain is something that we very readily think of because it's anti-inflammatory, it helps with endogenous opioid-like substances, but there also can be a lot for hormonal regulation. There also can be a lot for enhancing organ function. So there are many, many different things that you can consider and a lot of conditions that I use acupuncture for. I use it a lot in chemotherapy support in my cancer patients. I use it in support of my kidney and liver disease patients. I use it in all of my patients with neurologic conditions, arthritis, disc herniations, and even behavior because it can be very relaxing and sedating. So don't think about it just for pain. There's a lot of other potential possibilities. And the nice part about it is that really, as long as it's performed in the hands of a practitioner that knows what they're doing, it's very, very safe. So think about it the next time that maybe something's going on with your animal. It could be of benefit. Ask your doctor about it, see if you think it would be a good fit. And I hope you enjoyed.